When my issues started that ultimately led to my diagnosis, I would wake up not being able to move my fingers. They would be locked. My hips and my back would be very painful, and it affected pretty much all the joints in my body. It was very unpleasant and kind of spooky and scary. My name is Nathan Filio. I'm an organist at the Broadway Theater in Pitman, New Jersey. I'm also a registered nurse. That's been the better part of my life for the last 38 years. And I've been the organist here at the Broadway Theater since 2002. Playing the organ is fairly physical. You have to balance yourself on the bench. We use all of our appendages. We use both feet, both hands, all 10 fingers. And as it got worse, I found myself spending more time just sitting on the couch because it was just uncomfortable. And not only did my joints hurt, I often felt like I was getting sick. I often had that feeling like I had the flu. So it wasn't just the joints, but it was everything. It affected every part of every aspect of my life. Like everybody else, I went to my family doctor, who just said, just muscle strains and muscle aches and pains. Never asked me very much beyond that. I saw orthopedic doctors a few times and would occasionally inject the joint and say, this is just normal wear and tear. But it kept getting progressively worse. And at some point, I thought maybe it might be a good idea to see what a rheumatologist had to say, not knowing a lot about rheumatology. And when I did, I left with being told that, no, it's not all in my head. I actually do have something.
So Mr. Figlio, I have been seeing him for almost past 10 years. And when I saw him initially, he came with me. He has a crippling arthritis. He has a lot of back pain, joint pain, and he was crippled. His life was totally crippled. So with all the blood work we did, x-rays we did, examination history, eventually we came up with the diagnosis. He had something called seronegative spondyloarthritis, which is one of the inflammatory conditions which can affect your spine, your joints, your knees, your big joints. And the issue is, if you do not treat the inflammation, it can cause a lot of disability, a lot of pain.
After I started treatment with the Dr. Singh, with all his interventions, I was able to sleep well and wake up feeling like a normal person. I was able to get back to hiking and doing some cycling and horseback riding. And so it brought things back significantly to me. It made me feel better.
When we came up with the diagnosis, at that time I started him on medication we call DMARDs. They're disease modifying agents. They can stop the disease. And typically in his case, we used medication like methotrexate, and at some point we transitioned to something called sulfasalazine. And he responded well initially. Over like a year or two, we realized that his symptoms were not well controlled. So we proceeded with a new therapy called biologics. And biologics are new medications which we have as a rheumatologist using for the past 10-15 years, and which can really stop a disease, halt the disease.
I'm very grateful that my paths crossed with Dr. Singh and his colleagues at Arthritis, Osteoporosis, Rheumatology Associates, because without them, I'm not sure that I would be where I am today. They're easy to get in to see. It doesn't take me a long time to get a visit, unlike some of my other physicians that I have to see. They take whatever time you need to get your questions answered and to make sure that they address what your concerns are. And try and make a difference. I'm very pleased. They've allowed me to continue to do the things that I might not be able to do. The joints that are affected affect my fingers and my feet and my shoulders, all of which it required to be pretty fluid and active to be a musician. And so I'm not sure I would still be able to play today if I didn't have the help of my rheumatologist. And, I owe a lot to Dr. Singh.